I'm Maris Weber, Director of World Trade Center Epidemiology of the Fire Department of the City of New York and Professor of Epidemiology and Population Health at Albert Einstein College of Medicine and Montefiore Medical Center. My colleagues and I have been studying a cohort of about 16,000 workers, both firefighters and EMS workers, who were exposed to the World Trade Center. And we have an article that we're here to discuss today. This article will appear in the January 2016 edition of Mayo Clinic Proceedings. The title of the article is Post 9/11-2001 Incidents of Systemic Autoimmune Diseases in World Trade Center Exposed Firefighters and Emergency Medical Service Workers. Our research study had two primary goals. The first was to estimate the frequency of newly diagnosed systemic autoimmune diseases in about 14,000 male rescue recovery workers enrolled in the Fire Department World Trade Center Health Program. And second, we wanted to compare how often these conditions were diagnosed in our rescue recovery workers relative to how often they were diagnosed in demographically similar men participating in the Rochester Epidemiology Project, which is a population-based database from Olmsted County, Minnesota. The idea was to see if men who worked at the World Trade Center site were more or less likely to develop systemic autoimmune diseases compared with men of similar age and race who never worked at the World Trade Center site. The specific autoimmune diseases of interest included rheumatoid arthritis, psoriatic arthritis, systemic lupus erythematosus, and others. We included all cases that were diagnosed between 9/12/2001 and 9/11/2014. We generated expected rates based on the Rochester comparison group rates during a similar time period. Importantly, we also examined FDNY rates by level of World Trade Center exposure. Those with higher exposure were workers who either arrived to work at the World Trade Center site during the morning of 9/11, when the dust cloud was the most intense, or who worked at the site for 7 or more months. All other workers were considered to have lower exposure. I should note that most studies of workers find the healthy worker effect reduces any association between exposure and disease outcome, which we can observe in the table. If we look at the table, which is table 2 from the upcoming article, we see that in the top third, overall for the entire FDNY cohort, the expected rate based on the Rochester comparison group was 80.3 expected cases, and we observed 78 cases, which is quite close. In the middle panel, however, we see that in the highly exposed, those highly exposed to the World Trade Center, we would have expected 22.3 cases, but in fact we observed 30 cases. In the lower panel, we see profoundly the effect of the healthy worker, which is the expectation was nearly 58 cases, and we observed 48 cases. In total, we identified 97 post 9/11 SEDS cases, systemic autoimmune disease cases, in the FDNY cohort. FDNY rates overall were not significantly different from expected as generated by the Rochester comparison group. However, the lower exposure group had 10 fewer cases than expected, and the higher exposure group had 7.7, nearly 8 extra cases. So to conclude, rates of autoimmune diseases were similar between FDNY and the Rochester comparison group, and this masked differences in incidence by level of World Trade Center exposure, especially because the highly exposed group was relatively small compared to the full cohort. Continued surveillance for early detection of SEDS, especially in highly WTC-exposed population, is required to identify and treat exposure-related adverse effects.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.